Okay, so I have the privilege of announcing the next presenter to you, and her name is Lauren Zelouf, and she has her master's in social work, and she is a licensed clinical social worker. So she's here to talk to you a little bit about what to expect if you engage with a social worker. So please help me welcome Lauren.
Thank you so much for having me. I'm Lauren Zelouf, a clinical social worker at the Parkinson's Disease and Movement Disorder Center at the University of Pennsylvania. At our center, we have the Penn Ataxia Clinic, which is a specialized and multidisciplinary clinic for patients living with genetic causes of ataxia. At our center, my role is really to support patients and their families living with ataxia. And today you'll learn about what a medical social worker can help you with in this context. And you'll learn about how to find a social worker near you, as well as what are some other community resources that you can have access to help you and support you throughout your journey with ataxia. So one caveat I wanted to give is just that my talk is really geared towards adults and older adults living with ataxia. I do think the resources will still be helpful for younger folks with ataxia, but if you're looking for resources specific to your children, I suggest reaching out to your child's neurologist or pediatrician, or even their school counselor or social worker for more resources specific to their age group. This is my disclaimer slide, and I have no disclosures. So before I go into what my specific role looks like at the Penn Ataxia Clinic, I wanted to first give everyone a basic understanding of what social work is. So according to the National Association for Social Workers in the Code of Ethics, the role of social work, or the mission, is to enhance human well-being and help meet basic human needs of all people. Additionally, a historic and defining feature of social work is the profession's focus on individual well-being in a social context and the well-being of society. So what's fundamental to social work is the attention to the environment forces that create, contribute to, and address the problems in living. So essentially what that means is that we're all impacted by outside forces. So what goes on in the community, at home, at work, and in our interactions with other people, all of those outside forces impact us. So we see out of a person and environment perspective, meaning what goes on, again, in the environment has an effect on us. So this is kind of like the lens or the framework that I see out of that guides me in my work with my patients and families. So my social work role. So essentially at the Penn Ataxia Clinic, where I work, I see myself as being a supporting someone throughout their journey with ataxia, wherever they are in their journey. So a huge social work motto is meeting people where they are, which really means honoring where they are in that moment and respecting that and not pushing them past that. So kind of honoring what someone needs today in the moment. And what's key with our clinic is being able to communicate and collaborate with team members. So I work with physical, occupational, speech therapists, a genetic counselor, physicians, fellows, a nurse practitioner. So we all work together to best support our patients and families that we work with. So today I'll be talking about 4 practice areas that I can provide support with. A lot of the times I hear that social workers just provide resources. So we actually do a lot more than that, but resources are huge and we will cover that. So I help to provide emotional support and therapeutic intervention. I provide education, long-term planning, and again, help with resource connection. With anything, we all have limitations. So my limitations, I would say, is that sometimes I might be confronted with a question that I don't know the answer to. We all have that. So I might have to do either my own research or, again, the beauty of working on a team is being able to look to my other team members and collaborate. And if it's outside of my scope of competence or my scope of practice, I can always reach out to my team members and share ideas. There we go. So I thought this was a great illustration. It says, "Pooh, what's the bravest thing you've ever said?" asked Piglet. "Help," said Pooh. So I think this is a great illustration because it just shows how much courage it takes to ask for help. And I do want to acknowledge that, because I think when someone picks up the phone and calls and reaches out to a social worker, it's not easy. And so I just want to mention that it does take courage to ask for help. So the first area I'm going to be talking about is providing emotional support and therapeutic intervention. So when I work with people and I'm providing emotional support and they're sharing with me their fears, their struggles, their concerns, I want to create a safe space. So that's the first step. I'm assessing psychosocial needs. So what does that mean? It's thinking about the whole person, assessing someone's physical, spiritual, mental, emotional, all of their needs, and really getting a sense, again, of everything that impacts them. Some questions I might ask are your basic needs being met? Are you able to take care of your own personal care needs, your dressing, your bathing? Are you able to prep meals for yourself and take care of yourself? Do you have a support system? Is your living environment conducive to your mobility challenges? Do you have healthy coping skills when you're feeling down? Do you have an outlet of what can help you? So processing grief and loss. So that's a big part of the conversations I have with folks. Grief and loss is not something that just comes at diagnosis, but it happens throughout the course of the disease. With people that I'm working with ataxia, it could be talking about the loss of someone's identity, the person they used to be. It could be loss of independence, loss of control over your body or your bodily functions, or it could be with a care partner or caregiver, something called anticipatory grief, anticipating a loss, or something called ambiguous loss, which is the person that you love is still there, but they're not the same person they used to be. So losses occur throughout the course of the disease. Changing roles and responsibilities is when we see something called a role reversal. So maybe as a care partner, you care for your spouse, and your spouse used to be the person who did the bills, for example, or handled the finances, and now it's your job, and you have to learn that new role and responsibility. So my role is help kind of acknowledge that these things exist, validating that, and then also processing through those. Assessing for the well-being of a care partner. So being a care partner or a caregiver is a big role. I don't have to say that to you all. So recognizing that strain and burnout exists, and that's when the care demands are higher than what someone can offer, and that someone's physical and emotional health is compromised. So kind of encouraging people to take care of themselves and helping to really, hopefully we meet before this happens, but if not, it's kind of identifying when someone feels very overwhelmed and being able to identify what resources exist and problem solve so that we can come up with a way to get you some respite and get you some help. And then that leads into identifying a need for support groups, right? And I think what we saw from the Birds of the Feather session yesterday is just being in a room with other people who get it. You don't have to explain yourself. They understand and can relate to your experience. How comforting and validating that can feel. So I might be looking for support groups on the NAF, or I might be referring people to more individualized therapy or counseling. And we'll talk about later of how to find a therapist near you. Sometimes I facilitate family meetings, so that could be helpful when I notice there's a family conflict, and it will be helpful to get everyone on the same page so that we're all communicating about the person's care, and we can come up with a plan. And then finally, the nitty-gritty part of social work is crisis intervention. So then if there is a mental health emergency, being able to intervene and point people to the right crisis resources. It could also be assessing for abuse, neglect, or exploitation as a mandated reporter. So education. So this is another huge pillar of social work. So education is essentially sharing information so that people can feel informed and know what their options are going forward. But also it's to help better understand and cope with illness. Making sure you have the tools and the knowledge to make the best decisions about your loved one's care. So usually that can include a bunch of different things, but the first thing is being able to assess someone's level of understanding around their diagnosis and their symptoms. So providing disease-specific psychoeducation. So it's helping someone make sense of their disease and what it means to them, and how it's impacting their life and their interactions. Assessing for mental health issues, so that we know that depression and anxiety are symptoms of ataxia, right? So being able to recognize when that happens, and what are some ways that we can cope with it. So that might mean me referring someone to a psychiatrist so that they can get medication management beyond what your neurologist is offering. Or maybe it's referring you again to a therapist. So in addition to the coping skills you already have that you've used in the past to deal with difficult and challenging experiences, maybe there are some other coping skills we can talk about to help you when you're feeling stressed or you're feeling down. How do you manage through that? So sometimes I talk with folks about maybe introducing mindfulness or concepts of cognitive behavioral therapy to help with those moments so that you can pull it out on your own when you're feeling that way. And then a huge part of my job as a social worker is really educating people about the healthcare system, which is very confusing. And you don't learn about it until you have to navigate it. So being able to educate people about different levels of care, whether that be in the home, in the community, facility level, or residential level care. And also understanding the difference between federal and state programs, understanding what Medicare is and what Medicaid is. And a lot of people don't know all these things until you have to face it. So my role is to really provide education and support around it. So long-term planning. So I once heard a social work colleague say, every worry needs a plan, which I really liked that. Because I think what can happen is we know that the future is very uncertain, scary, but I think what can ease your anxiety is coming up with a plan so that you can put it away and then you pull it out when you need it. So that means anticipating your needs changing, knowing it's a progressive disease, and knowing what your options are. Because if you don't know what's out there, it's hard to plan, right? So that's my role, is being able to provide education about what options there are and help you come up with a plan. So one part of that is creating an advance directive. So, there's a few parts of that, and it's having documents in place. So again, once you create it, you don't have to look at it until you need it. But a living will is essentially a document where you put down what kind of medical care you do or do not want. A durable power of attorney for health care is where you identify who is going to make decisions on your behalf when you can't speak for yourself. You want to make sure that's a trusted person, right, that understands what your wishes are. And that's why I'm encouraging having these open dialogues now with the people that you love, that know you, and that you can share kind of what's important to you and what your values are. And then the financial power of attorney is someone who's making those financial decisions on your behalf. Some other parts of long-term planning comes up when someone is still working and they're noticing that their symptoms are interfering with their work performance. So sometimes the conversation is, even before you're noticing that, it could be that you're working, you've been newly diagnosed with ataxia, and you're trying to figure out, when do I need to disclose to my employer, and how should I do that? If I need an accommodation, if I want to continue working, but I just need to learn kind of what are some ways that I can be accommodated, whether it's maybe it's cutting my work hours, or so I'm not working that long shift and fatigued because I'm working so long. Or maybe instead of working out in the field, I'm back at a desk job. So talking about different accommodations so that you can still do what you love, just in a different way. And then also the disability accommodation or application process, which includes, first finding out, do you have a disability policy at work? And then how do you apply for Social Security disability insurance, which is very complicated. So having some support can be helpful. And then lastly, discussing future plans and goals. So when I think about this involves thinking about, what are my goals for the future, and really, again, building awareness of what my options are. So some questions that you might think about is, where do you want to live? What's your preferred living arrangement? What kind of care do you want or don't want? And who do you want to provide that care? Is it a family member? Is it a friend? Or maybe you don't want that. Can you hire help? Do you qualify for anything? So these are some things to kind of, wonder about and get you thinking. Usually what I hear from, just anecdotally from my work with patients and families, is the goal is typically to stay at home as long as possible, right? Most people want to live at home. So as a social worker, my role, again, meeting people where they are, how can we do that so that you stay safe and your home is still accessible to you? So we might talk about what resources exist so that you can stay at home. Some other things, just looking at the photo on the right here, are different levels of care. So let's say that the care needs that you're providing to your loved one exceed what you can provide, right? Becomes too much, too overwhelming. And they're no longer safe at home. You might consider looking into a facility and what different levels of care are out there, whether it's assisted living, a nursing home level, or even care at home. So just knowing, basically my role with that would be to provide what your appropriate level of care would be, right? And kind of what the process is. How do you find care? Resource connection. So I connect people. This is what a lot of people think a social worker does, and again, we do that, but we do a lot of other things too. And I connect people to resources depending on their needs. So that involves kind of identifying what's available in your area and doing a basic financial assessment of what you're eligible for. So that's usually based on your income and your assets. And then making those referrals to community resources. So for example, with in-home care, I know I'm speaking to people from all over the country, so the one national program that I often refer people to is the Medicaid waiver program for home and community-based services, HCBS waiver. And that's a way for people, adults, usually 18 to 21 plus, depending on where you live, to be able to live at home as long as you want, but with support, right? With in-home care, with aides coming in, or other community programs. I'm also sometimes referring people to different funding options that are available in their state for home modifications. So let's say, again, you want to live at home, but you might need a stair lift. How do I afford that? Sometimes I might be looking at, if you qualify for Medicaid, Medicaid will pay, the waiver will pay for a stair lift. Veterans benefits will pay for a stair lift. So figuring out what you qualify for can be very helpful. And then if we learn that you're not going to qualify for Medicaid anytime soon, usually I'm referring people to an elder law attorney, even if you're not, if you're a person with a disability and you're not elderly, they still tend to have a good knowledge base about long-term care planning and Medicaid planning, or it could be a financial planner. And then the other thing I want to point out on there is oftentimes people always ask me about finding equipment like a wheelchair or a walker, but maybe they're not looking through their insurance because Medicare will only pay for one wheelchair every 5 years. So if that's the case, how can I find the less expensive wheelchair? If I want to have Medicare pay for the motorized wheelchair, which is thousands of dollars, I'm going to have the less expensive wheelchair. I'm either going to get it not through my insurance, out of either out of pocket if I can afford it, or there's a lot of lending closets out there. So places that have refurbished and donated equipment that you can get for free. And they're all over the country. So those are the kinds of things that people ask me about that I might connect them to. So how to find a social worker near you? So I think the first step would be if you already seek your care with a neurologist or at an Ataxia center or at a specialty clinic or even a center of excellence, it's finding out if they have a social worker at the practice. You might just not have crossed paths with them yet or might not have needed to. It's checking the National Ataxia Foundation website, again, checking where if you have a center of excellence or a specialty clinic near you, being able to search on the website. Or it's contacting your primary care provider. If you're a part of a big institution or an academic center, typically there's a social worker, at that, hopefully there. Again, me being at a movement disorder center, we're required, like under the National Ataxia Foundation, as a specialty clinic or a center of excellence, we're required to have social workers there. So hopefully you can reach out to them, but if not, your primary care doctor. I would say the last option would be to contact your insurance. So when you call your insurance, you can ask to be assigned a case manager. They might not be a social worker. They might not have the training or education of a social worker, but they still could help you with providing access to resources. So they still might know about resources in your area, so I think it still could be worthwhile. And then finding care in the community. So everything on this slide are national resources. So when I mentioned before about that Medicaid waiver program for home and community-based services, how to apply for that is through these. So every county in the country has an area agency on aging, also called an Aging and Disability Resource Center. So when you go on this website, you can type in what county you're in or your zip code, and you can find where your office is. And this is a hub of information. So that's where you're finding what home care agencies are available in my area, what adult day centers, if I need a meal delivery program or transportation to my appointments. That is a great place to go for information. And to find out what you qualify for, if you qualify for anything. Medicare.gov has a search tool where you can type in your zip code and you can find home health services. So when I'm talking about home health, and I could do a whole talk just on this, would be finding skilled services. So home physical, occupational, speech therapy, home nursing. So that would be under your insurance. I'm not talking about a home health aide. Finding residential care facilities. So if you're looking for a nursing home, if you're looking for other continuing care retirement communities, which are where you find the independent assisted living nursing home when they're all in one level of care. I'm sorry, not one level, but one facility. Hospice care, so it's all there. A senior living broker is someone who can actually help you find this kind of facility care that I'm mentioning. I'm sure you've seen commercials of A Place for Mom on TV. They're free, so you can work with them to help you locate a facility or even just to know what's out there. Again, you're not paying them anything. The way they get paid is they work with participating communities, and essentially if you move into the place that they helped you locate, they get paid by that facility. But they do work with a wide range. But let's say you just want to know what your options are and you're not committing to anything, it's just a good resource to have. So if you're a veteran, knowing that you might have access to veterans benefits, if you haven't filed a service connection claim to see if you have access to any benefits, that would be a good place to start. The only thing on this list that is a cost is a geriatric care manager. So that's someone who, sometimes they can be a social worker, sometimes they can be a nurse, it depends. But they're providing a little bit more hands-on help than what I can offer, being at a big practice. And essentially what they do is, at a center, I'm not going to your home, right? I'm not going to, the hospital if you're hospitalized or rehab, or I'm not going on a tour with you to a facility that you're visiting. They can go where you are. So they can walk it through with you and provide you a little bit more individualized support than maybe what I can offer. But that's if you have the means, because it is an out-of-pocket cost. And you can search for one in your area on aginglifecare.org. And then some resources for mental health support. Again, we know depression and anxiety are symptoms of this disease, so we want to make sure you have access to resources if you need it. So the National Suicide and Crisis Lifeline is a 24/7 hotline. You could call 988 or send a text to 988. You would be connected to a trained crisis counselor. And that's someone who works at a 988 Lifeline network crisis center that's closest to you. So it's based on the area code that you're calling from. So this person can help to support and assess if you need to be evaluated at a crisis response center if you are in suicidal crisis. The crisis text line, you would text HOME to 741-741, and that's for text messaging, crisis counseling. You would also be connected to a volunteer crisis counselor. But the difference is they actually would help with a wider umbrella of resources or mental health issues. So let's say if you're dealing with depression, anxiety, eating disorders, self-harm, so a little bit wider than just suicidal crisis. The Substance Abuse and Mental Health Services Administration can help. They're a treatment and referral resource. So essentially, if you call and you're looking for a drug and alcohol rehab, they can help to refer you to one. And then how to find a mental health therapist. So usually the first step, just to ensure that they take your insurance, would be to call your insurance and find out, a list of in-network providers or in-network behavioral health or mental health providers. Or another option is using a therapy finder like Psychology Today. You can actually put in your zip code, put in what your insurance is, select the issues that you're struggling with, whether it's depression, grief, caregiver, struggles, or whatever it is. And you can find you can find therapists in your area. Something that I often get asked is, well, will they know anything about ataxia? Probably not. So sometimes as a social worker at a specialized clinic, my role would be offering to provide education to your therapist with written consent so that you don't have to be the person kind of to bear that burden of educating someone else about your disease. So sometimes I definitely offer that if you end up finding a therapist that you connect with, because that's the biggest part, being able to share the things that you can't tell anyone else maybe. You want to make sure that you feel safe with them and you connect with them. And if the one thing they don't have is knowledge about your disease, we can take that burden away from you and I can help provide education. Thank you so much for having me. And I'm done. Does anyone have questions? Yeah, go ahead.
Hold on, I'll run a mic over to you.
Oh, sure.
I'm a neurologist at University of Minnesota.
Oh, wow.
And I have had many patients who have donated their brains to the Ataxia Foundation, not to the foundation itself, but to Dr. Laura Ranum at Gainesville. But the Ataxia Foundation will arrange for that. I think a social worker can get involved in that too. And the other area is, for myself, I'm bequesting my body to the anatomy department at the University of Minnesota. And so I'm a healthy person, don't have ataxia. So I think those two things, bequesting one's body if you're healthy, and the other thing is to donate the brain of an affected individual.
Yeah, that's a great point. I mean, of course, I didn't talk about everything that I do because, I mean, I definitely provide, education also about end of life and, palliative care and hospice. People do ask sometimes about donating their brain or donating their body to science. Sometimes, like at Penn, as an institution that does research, sometimes you have to already be in a research study to do that. But that's great that you're doing that. I mean, it's, that's amazing that you're doing that.
Got another question over here.
So you have ataxia, and you obviously have a problem, but you haven't been diagnosed. What resources can you get?
So as someone, even with a disability, we don't know what's the cause, you can still access, so I think the first step, I really do think that Office on Aging, the Area Agency on Aging or Aging and Disability Resource Center, they have really long names, that's why I tend to use the acronyms, but that's a great first step because you still need help, we just don't know what's the cause, right? So I think that would be finding what the one, it depends on your county, so where you live. So figuring out what that place is and being able to call and find out, do I qualify for anything? Even when you don't have a diagnosis. You're still having symptoms that are affecting your day-to-day life. So I would say that would be the first step. Okay.
Hi, thank you for being here. I had a comment and a question. My comment, first off, was my daughter was on a waiting list for 8 years to get a counselor. She finally got a counselor, about 2 months ago, and the counselor's a really good fit, but 8 years, it's still really a process and really hard to find counselors. Then my question was, we're in the process of changing from like managed care to long-term care.
Yeah.
I have been frankly, I've been worried about getting a social worker involved because we have her SSI set up, we have everything set up, and she's on Medicaid because she, aged out of our insurance years ago. And I've been worried about contacting a social worker because I don't want to screw anything up. Do I have anything to worry about with contacting a social worker to try to ease us into a more long-term care?
So a social worker is not going to, it's based on what you want, right? Like when someone says to me, for example, just to give you another example, I'm afraid to reach out for help because I don't want someone to tell me I need to go into a nursing home. Well, if you don't want to go into a nursing home, then then let's talk about what you do want, and let's figure out how we can get you to stay home, again, like I mentioned before, and stay safe. So it's meeting people where they are and honoring what their needs are. Another essential, I guess you could say, principle in social work is honoring someone's self-determination. So if you're looking to transition her for long-term care and you just need some guidance, I think that's a great reason to reach out to a social worker. But it wouldn't be to push you to do anything, right? It's just supporting you with what your goals are now. I get the hesitation, but I think a lot of the times people think about social workers as removing kids from the home, right? That's what people think about. Or the concern is that you're going to be put into a nursing home. But that's not our role. We're not the police. So I'm talking about being a medical social worker. We're really here to support you.
Thanks so much, Lauren.
Thank you.